Let's dive into these weight loss drugs that are everywhere in the news lately. Ozempic, Wegovy, and Mounjaro Zepbound.
Yeah, it's fascinating, right? Not just the science, but the whole scene around them. Big pharma players like Novo Nordisk and Eli Lilly. Then you've got compounding pharmacies scrambling to meet demand. And of course, the patients stuck in the middle.
Exactly. Feels like a high stakes game with a lot at stake. So let's break it down, starting with the basics. What are these drugs and how do they work?
Well, they're not your typical diet pills. Ozempic and Wegovy use semaglutide, while Mounjaro and Zepbound use tirzepatide. Originally, these were for type 2 diabetes. Right.
I've heard of it. So how'd they become the weight loss miracle everyone's talking about?
Turns out there's this interesting side effect, significant weight loss. They're part of a drug class called GLP-1 receptor agonists.
Okay, that's getting a bit sciencey. Can you explain it for us non-scientists?
Sure, basically they mimic a hormone in your gut. It signals to your brain that you're full, helps regulate blood sugar, which is why they work for diabetes, but it also leads to weight loss, reduces appetite. You feel fuller for longer.
So it's not just about willpower. It's actually changing how your body reacts to food. No wonder everyone wants it.
Absolutely. And that's where the trouble began. The demand was so high, Novo Nordisk and Eli Lilly couldn't keep up, leading to the shortages we've all heard about.
And that's when compounding pharmacies stepped in. Right.
Exactly. They saw a way to fill the gap, creating their own versions, often cheaper, which has been huge for patients who can't afford the name brands or don't have insurance.
So it's David versus Goliath. Small compounding pharmacies helping out when the big guys couldn't.
On the surface, it seems that way, but as usual, it's more complicated than that. Big Pharma is now arguing the shortages are over. Compounding should stop.
Why? Are they worried about profits?
Well, profit is a factor for sure, but they also claim safety concerns. They say compounded versions might not be as safe or as effective as the FDA-approved drug.
I can see that. You want to make sure people are getting medication that's safe and reliable.
Of course. But compounding pharmacies argue they're providing a vital service to patients who might otherwise go without treatment. They say they follow strict guidelines to make sure that compounded medications are safe and high quality.
So who's right? It sounds like both sides have valid points.
That's the problem. It's not black and white. This situation really highlights the tension in healthcare between safety and affordability.
Meanwhile, patients are just trying to get the meds they need.
Exactly. That's the core issue. Here's an example. Jennifer Birch, a compounding pharmacist in North Carolina.
What about her?
Even after the drug company said the shortage was over, she still couldn't get enough of the name brand to meet her patients' needs, so she kept compounding to make sure they could stay on their treatment.
So the official shortage was over, but the reality was different.
Exactly. And this difference between what's officially declared and what's actually happening is the big theme in all this.
I'm starting to get how messy this is. The companies say the shortage is over, but pharmacists like Jennifer are saying, hold on, I still can't get the medication my patients need.
Exactly. And that raises some questions about how the FDA decides when a shortage is really over. Does the system reflect the reality for patients and doctors?